Okay, so it's 9 a.m. and we are going to transition to our next session. And the next session is entitled Shifting Perspectives, Collective Action for Disability Inclusion in Health Professions Education. This is our keynote speech. It's going to be given by Dr. Lisa Meeks from UIC and moderated by Heidi Joshi. And I'm just going to say that Lisa is my mentor and one of my best friends, and she's just doing the most amazing work for our community. So I'll let Heidi introduce herself and introduce Lisa, and take it away. Thanks.
Hi, everybody. I'm Heidi Joshi. I'm so happy to be here, and it's such a privilege to get to introduce Dr. Meeks. I am, for visual description, I have white female, I have short brown hair with glasses, I'm wearing a navy blue jacket. I am an assistant professor at the University of Michigan in the Department of Family Medicine, and again, just thrilled to be here. I could spend some time telling you all about the more than 100 articles that Dr. Meeks has published in the last 10 years. I could tell you about the Docs with Disabilities Initiative, which has brought to center stage the experiences of providers with disabilities in medicine. I could tell you all about her global reach internationally. I really want to tell you about the kind of mentor that she has been to so many people, as Dr. Polis mentioned. Dr. Meeks is so generous with her spirit, her time, her energy, that all of us are so grateful to you, Dr. Meeks, for what you have given to this profession and now to the world. But in the time between the inception of Dr. Meeks' talk and today, a great deal has changed in the world, changes that have only heightened the urgency of her message. What was originally planned as a conversation about advancing disability inclusion has evolved to talk about the a powerful call to collective action. Today, Dr. Meeks will share why collective action and leadership, why disability justice principles must guide leadership, why resistance is an ongoing collective act. Please join me in welcoming Dr. Lisa Meeks.
Thank you so much. You're both going to make me start crying before I even start. I appreciate it. My visual description, I am a 54-year-old female with short blonde hair, wearing glasses that are turtle brimmed at the top, with bags under her eyes from the last week of events globally, and just very happy to be here with you this morning. So wherever you are joining us from, good afternoon or good evening or good morning. And I just want to thank Pete for giving me this opportunity. It's truly an honor, and I have taken it very seriously. And I appreciate the opportunity to speak, even when this week has been one of the hardest weeks. When I first accepted this talk, I could not have imagined the context we would find ourselves in today. We are gathering at a time of profound challenge. Just this week, 2 executive orders in the United States were signed that threatened to dismantle the very foundation of equity, inclusion, access, and justice in higher education. These orders aim to silence the work that many of us in this space have spent our careers advancing, work that centers diversity, that defends civil rights, and that acknowledges the full humanity of every learner, educator, and patient. These actions do not merely curtail programs or policies. They attempt to erase the legitimacy of diversity work itself, work that for decades has shown that diversity strengthens learning, innovation, well-being, institutional success, patient care outcomes, and health equity quality. This is not just an administrative shift. These actions are an attack, not just on programs or language, but on people, on communities, on values, and on the truth. And yet, here we are today from all over the world, coming together in solidarity. We are still gathering. We are still showing up. We are still doing the work. This work does not live in siloed spaces. It lives in relationships and it lives in communities. It lives in people and our collective refusal to go backwards. Each of you here today, regardless of where you're coming from, knows the feeling of profound isolation, a feeling like you are all alone in this, a feeling like you are in a system that was not designed for you. And oppressive symptoms rely on this. They rely on those feelings of isolation. They seek to convince us that our struggles are private burdens, isolated events, rather than collective injustice. They whisper to us when we're alone, especially. Pete and I talk about this. They say, your voice is small. Your exhaustion is yours alone to bear. You're not strong enough. You are alone. They want us to see these struggles as private burdens, not collective injustice. And in our research, and many people's research on students with disabilities and health professions education across the world, one clear through line emerges, and that's structural isolation. Isolation not by accident, but by design, embedded into the very systems that students are asked to trust. Just last week, a student described her experience navigating accommodations as being trapped in a circular maze that had no exit. Every time she reached out for help, the maze shifted. Another office, another requirement, another piece of documentation, telling her story to another unfamiliar person. Each time, what she needed moved further out of reach. Eventually, she stopped asking. Not because her need disappeared, but because exhaustion and broken trust made the answer clear. This maze was actually never built to guide her to access. It was designed intentionally to teach her that she doesn't belong here. And it's not just students experiencing this isolation or feeling like they're in a maze with no exit. Faculty often sit in fear, unsure how to support disabled learners without risking professional consequences. Disability resource professionals work tirelessly, yet they're shut out of structural and curricular decisions. Even deans, despite having formal authority, can feel trapped by bureaucracy, this week by fear and risk. This is not an anomaly. Every handoff, every silo, every bureaucratic shuffle in our system, these are not accidents. These are predictable consequences of systems that fragment responsibility and isolate leadership to very few at the very top. Systems that were never designed to work together. And I would argue no one is immune from the loneliness of trying to drive change inside a resistant system. When leadership is isolated, students, faculty, and staff, and patients get trapped in the maze. So today, I'm urging you to consider how we hold the line together, how we continue to, even as others try, to dismantle, to delay, or to shift their tactics to make sure that exclusion exists. Because when systems are designed to divide, to isolate, and to exhaust us, the only way forward is together. Not through individuals or some sort of heroism. We're all struggling. And not through individual struggle against what seems like an insurmountable amount of pressure, but through collective leadership, through collective action, and through collective care. So for me, collective leadership is the shared commitment to move forward together. It's rooted in trust, mutual responsibility, and the belief that no single person holds the key to the maze. That justice cannot be built alone and is rarely successful when only a few, and only a few at the top, are involved in decision making. Collective leadership is not the absence of individual responsibility, it is the multiplication of it. It demands that we dismantle the maze together and reorient access from the start. It calls on each of us to recognize our power, our privilege, and our role in advancing disability justice, and to act, not alone, but alongside one another. In this moment, it is so easy to feel overwhelmed, to feel isolated, and to feel small. But history reminds us that isolation is not an accident. It's a strategy. It's a strategy of this administration, and it's been a strategy of others. Therefore, we can't look at solidarity as a luxury. It has been, and always will be, a mechanism of survival. Movements succeed when solidarity becomes a living, breathing force. When we recognize that our struggles and strengths are interconnected. Movements from justice, from civil rights to LGBTQ+ liberation, have succeeded not because of one individual, but because of collective, coordinated action. As you heard earlier, and I'll remind you now, in 1990, disability rights activists from across the country gathered at the steps of the US Capitol. Denied access to the very building where laws were made, dozens of activists left their wheelchairs and mobility devices behind, and they crawled up those steps by hand, one painful movement at a time, to show the world that the barriers are not symbolic, they're literal. Collective defiance changed the course of history that day. It was a community that refused to be invisible. It was solidarity, undeniable and unstoppable. And weeks later, as you heard earlier, Congress passed the Americans with Disabilities Act. The Capitol Crawl reminds us that when we move together, change is possible. It is inevitable. Today, we continue the spirit of collective action through the work of so many extraordinary communities, connected by a foundation of shared goals, shared responsibility, and leadership by disabled people themselves. In the US, the work of docs with disabilities, medical students with disability and chronic illness, and Stanford Medicine Alliance for Disability Inclusion and Equity all represent groups formed under shared goals and driven by collective leadership. That same spirit drives global national efforts like the Canadian Association of Physicians with Disabilities, Doctors with Disabilities Australia, Disabled Doctors UK, and in India, Doctors with Disabilities Agents of Change. These organizations don't work in isolation. They share knowledge. They amplify each other's voices and work, and they strengthen one another's efforts. Together, they show that collective leadership, leadership informed, created, and sustained by disabled people, is not only possible, it's already reshaping the future of healthcare. Across countries and contexts, across disciplines and generations. We are building something larger than any one institution or nation. We're building a movement. This is the power of collective leadership in action. But building this, a movement like this, one that crosses institutions and borders and generations, it doesn't happen by accident. It requires intention. It requires structure. It requires shared principles that hold us together when the work is hard, and it is really hard. And it protects us. Because when leadership is collective, no single person bears the burden of keeping the torch lit. The flame survives because it's carried together. In this way, it guards against the exhaustion and burnout that so often extinguishes isolated efforts and individual people. It reminds us that while the work is heavy, it was never meant to be carried alone. Survival requires community, but transformation, real, lasting change, requires structure and solidarity. Through years of research, organizing, and collaboration, I've seen that successful collective leadership rests on 3 pillars: distributed responsibility, relational trust, and collective adaptation. These pillars aren't optional. They are essential for dismantling systemic barriers and creating conditions for true disability inclusion in health professions education. And it's through these pillars that we'll move beyond survival to justice. They're simple but powerful. First, we must have distributed responsibility. Leadership must not be concentrated in a single person or a single office. Collective action depends on everyone: students, faculty, disability resource professionals, clinicians, staff, administrators, everyone seeing themselves as stewards of equity, each person advancing access in their role and their reach. Second, relational trust. Because true collective action demands more than shared goals, it requires trust across roles and across differences. Trust that faculty will support the accommodations, that DRPs will be informed and specialized in a manner that translates to effective advocacy, that leadership will listen with humility, and that learners can bring forward their needs without fear. And third, collective adaptation. The understanding that movements must evolve together. No single leader has all the answers. I know I don't. True collective leadership listens deeply. It learns actively and it adapts dynamically, drawing wisdom from students. Oh, the wisdom I get from my students, from educators, from patients and policymakers, from all corners of our community. With these 3 pillars, strong movements don't just survive, they go stronger, especially under pressure. When they are weak, efforts fracture, and the weight of fear and fatigue and isolation can pull them apart. So these pillars are not just strategies for reorganizing institutions. They are rooted in something deeper: principles of disability justice. You've just heard a beautiful talk on that. Distributing the responsibilities mean that leadership must be shared. It reflects the principles that those that are the most impacted must have the power to lead, and that true justice can never rest on the shoulders of just a few. Relational trust means that building connections strong enough to withhold fear, disagreement, and change requires solidarity, collective access, collective action. Without trust, there's no community, and without community, there's no justice. And collective adaptation reminds us that movements must be able to change and respond and regenerate if they're going to endure. and we certainly are going through that right now. Critically, disability justice teaches us that sustainability is a necessity. Because no one person can do this alone, collective leadership protects against isolation and burnout. It honors the truth that interdependence is not weakness, it is strength. It's how we survive, and at the end of the day, it's how we win. Collective leadership puts disability justice principles into action. It's leadership that's relational, accountable, interdependent, and collective. It's leadership that sustains not only movements, but so importantly, the people inside them. If we want to move from isolated efforts to collective leadership, we must assess the systems we are operating in. Therefore, every institution and every leader should be asking, who holds the power in your organization? Is leadership shared across roles or perspectives, or is it concentrated in a few hands? How is trust built and maintained? Is there space for vulnerability, disagreement, and mutual support without fear of retribution? How do we adapt when challenges arise? Do we listen to those most impacted? Do we revise strategies openly, transparently, collectively? If the answer to any of these questions is unclear or likely uncomfortable, then serious reflection and evaluation is needed to determine how you might move forward, embracing and implementing collective leadership. Imagine a world where DRPs are strategic architects of health professions education programs and not administrative afterthoughts, where faculty are educated, supported, and empowered to design access into every part of their classroom and clinic, where disabled students are recognized as essential, not exceptional, to the future of healthcare. I think it's possible with collective leadership that's centered in justice. Collective action can be our survival strategy. It is a form of resistance. Disability justice offers a radical reimagining of leadership and invites us to lead with care, humility, and interdependence. And so the question remains, what becomes possible when leadership shifts from solidarity pursuit to collective movement? And I believe the answer is a system where disabled healthcare professionals don't just survive, they thrive. Because we dismantled the system together, because we built structures of access and justice, because together we refused to be divided and chose to move forward. Today is a very special day. This conference is a very special event for so many people that find community in this day. I want to take a moment to honor two powerful members of our Docs with Disabilities collective leadership community in Access and Nursing, Sabrina, who you just heard, and Tess. Sabrina's call to action, grounded in resistance, clarity, truth, reminds us of the essential differences and the necessary strategies to move towards disability justice. She made clear that the work of justice demands deliberate, sustained action. Her words are not just an offering, they're a directive. They set the tone for what collective leadership truly requires of us. Throughout the day, you'll continue to witness collective leadership in action. You will feel it in talks on mentorship and allyship, and how we share responsibility for promoting disability inclusion in our learning spaces. You'll be activated and hopefully motivated by the barriers that disabled learners and practitioners continue to face. And you'll be moved by the work of a photographer who sees beauty in difference. Finally, you'll be energized by leaders advancing disability justice for people with disabilities, even as they navigate the complex reality that we find ourselves in our legal system. You will be reminded that attending today's event is an act of resistance. Choosing to be here, to listen, to learn, to find solidarity and joy in each other's company. This too is an act of resistance. This too is movement building. Moments and movements often emerge from the simple act of sharing space. And I hope that today each of you connects with something at this conference that speaks to you, that finds a place where you find meaning, you find solidarity, and opportunities to contribute, and importantly, to lead. Because collective leadership is not about waiting for someone else to act. It's about recognizing that each of us has a role to play and a responsibility to carry forward. Thank you for the invitation to share space with you today. At a time when diversity, equity, inclusion, and justice are under attack, when the words themselves are being outlawed, standing here and saying them without apology is an act of resistance. My name is Lisa Meeks. I'm a disabled researcher working to advance diversity, equity, inclusion, and access. I support and am part of the collective leadership movement. And I am and will remain a fierce advocate, a trusted ally, and a committed accomplice in the fight for justice, alongside all of those who have been minoritized, marginalized, and harmed in our systems. I will continue to fight oppression, and importantly, I will continue to name them: racism, sexism, ableism, classism, ageism, heterosexism, transphobia, fatphobia, xenophobia, anti-Semitism, Islamophobia, and colonialism. I will continue to do the work to learn and to support everyone in this movement, because together we are the resistance, and together we are the future. Thank you.
Wow, thank you, Lisa. You're getting so many amazing reactions. Everyone is loving this. We have one question here from a participant who says, "Thank you for your participation and championship for people like me. I have lived 45 years as a quadriplegic and depend on others to survive. I serve as a behavioral health provider with the elderly and disabled. How can I continue to use my voice in the support of this effort with like-minded individuals?"
Oh, thank you so much for the question and for your work. Your work too is probably pretty hard. And thank you all for the grace of letting me. I was very strategic in my placement of tissues. I think sharing stories is one of the most powerful things we can do. I've always said in all of my research and work that there is a narrative that has been developed for us, and there's no counter narrative to fight it. Now, more than ever, that narrative is becoming louder and louder. And so we must work harder and harder to provide the counter narrative and to ground it in facts. We must let people know we're here, we're working, we are providing important resources and care for our patients. So I think telling the stories is the biggest thing that anyone can do. Write a editorial if you feel safe doing so. Tell your story on a podcast. Share your story in the classrooms, in the spaces that you're in. I think stories are the most powerful thing we have.
Thank you. Another person is asking, Lisa, what executive orders were signed this week? And is there a resource you could recommend for me to educate myself more on this?
Oh my gosh. Well, I don't think that I don't know that I have the stamina for one, but the executive orders that directly affect my work that were signed have to do with making accreditation agencies responsible for having kind of DEI focused work in their accrediting requirements. And so for those of you who know me and who have read my work, a good portion of my work is built on the foundation of this, especially in the graduate medical education space. Another one was a mandate that faculty at institutions attest that the work they're doing will not involve DEI work. And I will not be able to attest that. I will not stop doing my work, and I will not stop calling it what it is. So it puts me in a little bit of a pickle, as it does many researchers. As far as how to educate yourself on the topic, I think there are many sources to get this information, and that would be a personal decision about how you want to receive the information and through what lens. But just the orders, I would imagine you can Google.
Lisa, how can the global community support your work, and what does working together across borders look like?
Well, thank you for asking. I think this month, the last few months, really, one of the biggest asks that I've had is just to have grace with timing. We are working on things that are less outward facing right now. And I know the community is used to seeing us produce a lot of deliverables in the way of resources, and that will happen. But right now, I am taking care of people who work with us, shifting our priorities as necessary to support the work and support people. And I think just patience with the timing and the production of what we are delivering, because we are committed to the work, and you will continue to see important outputs from us.
Lisa, this question has been posted in a few different iterations, and so I want to share this one with you. How can the US show global leadership in disability justice and medicine as you have when you are just trying to survive the current administration?
Yeah. Yeah. Well, I think that certainly the leaders from all of those groups, we all know one another. We all reach out to one another. We provide kind of a lessons learned roadmaps. I think we can continue to support each other. I have the privilege of being in other spaces throughout the year, starting in June. So I'll be seeing a lot of these global leaders. And we will certainly, of course, talk about how our work can be sustained and how we can support one another. But I think that, if you had asked me that same question last week, I would have had a much different answer. I had don't mind the whack-a-mole approach to the work, because I thought every time we try to address something, it shifts. This week, it's like the flood is coming closer and closer to the front door, and decisions have to be made. Thankfully, we are so supported by funders and leaders who are not asking us to change. And that feels protective and good. And it is right now allowing us to move forward in our work and to support our learners and to shift our priorities as we need to. And that feels very, very good. And so I think we'll continue to do the work. It's just right now we are in a state of caring for people. Our organization has hundreds of volunteers that do this work without pay, many without recognition. Many people get published and have different levels of ways in which they contribute, but people are our most important asset in our organization. And so right now we're just shifting our work to focus on spending time with people and supporting people.
Lisa, I just want to give you some of the adjectives that are describing you, just so you can end your day on this amazing note. Super advocate, thoughtful, professional, amazing, champion. So thank you so much for being such a champion for all of us and for being so courageous in a time when we need all of us to come together. Thank you.
Thank you, Heidi. Thank you, Peter.
Wow, Lisa, I don't quite know what to say. That was extremely powerful. I know that we all see that you've been having a tough time lately, like the rest of us. I know that these executive orders have hit you particularly hard. And thank you for being so vulnerable and brave in your comments, which were absolutely inspiring. This idea of collective leadership and solidarity is just so important. And I wish I could give you a hug right now.